Welcome, freedom fighters, to another episode of the Angry Albertan podcast. I'm the Angry Albertan, and we have a special guest with us tonight. His name is David DICKSON. Hello, David. How are you doing tonight?
Good. How are you?
Oh, tired of this COVID crap.
Yeah, I hear you there.
Luckily, Dr. Hinshaw didn't enforce a second wave lockdown on us on Thursday. That was a bit of a concern, but we seem to have made it through for the most part, except for all the people who are being totally screwed over by all of this stuff already, even without a second lockdown. So,
did we ever really come out of a lockdown?
I don't think we did. They say we did. I mean, Kenny says he only closed 15% of businesses.
Kenny says we never had a lockdown.
That's true. That's true. I call that gaslighting.
Yeah. Somebody should.
So, David, for those of the audience out there who haven't heard about you, maybe you could just tell us a little bit about yourself.
So I'm what we'd call a Scouser. I'm from Liverpool. The S is a hard S, so it's not Scouser, it's Scouser. And it's I grew up in Liverpool, joined the police when I was a tiny little boy, and I had a career as a police officer till I got injured on duty. And then I said, screw it, I'm going to Canada. When I came to Canada, I set up an IT, cybersecurity sort of business, consultant business. Spent a lot of time working with police agencies, worked on one of the largest police justice projects ever in Canada a number of years back, where I found out exactly how policing works here, which is exactly the same as it does everywhere in the world. So I got to meet with a lot of interesting people, got to know a lot about how everybody's supposed to do the job as I did, and what police officers are like. And up until COVID, I thought they were all like me. I mean, there's a few that aren't, but I all thought that they took their oath of office seriously. And sadly, it appears not. Sadly, it appears they've lost the ability to think critically. They've lost the ability to do anything other than follow orders. Hearing the Nuremberg defense on a minute-by-minute basis as we go. As well as being a retired police officer, I'm also a cybersecurity consultant. I work in the cybersecurity world, privacy and compliance. Built a lot of systems. I've audited a lot of systems, investigated a lot of systems. I'm a forensic investigator, trained. I'm also a trained firefighter and PSU, Public Police Support Unit, first aider, but I'm not sure I could run up a set of ladders anymore. And I definitely couldn't carry any of that equipment. I'm far too fat and far too old for that. But that background sort of led me into having some unique insights when this all started back in December. I saw things happening that concerned me, shall we say. So I started reaching out back in December to all my colleagues across the world, from police officers to armed forces to spies. Not the James Bond type, the ones that sit in front of a computer and spy on you rather than go running around with their exploding pens. And all my worst fears were confirmed. This was not a pandemic at all. This was something completely different. And as we've all been living through, it is the virus was just an excuse, sadly. And anybody who's got even half a brain can see that. And the outcome of all of that is what we have today. People's lives ruined. And more importantly, as we're going to talk about, the first people who saw the impact of this are the ones that everybody said were going to take care of them, and we didn't. But anyway, we'll get to that in a few minutes. But yeah, so retired police officer, cybersecurity consultant, geek, and grey-haired, fat, old, disabled police officer to boot.
Well, the important parts still work, and I've sure noticed that investigative side of your personality, because I don't think there's hardly anybody out there who's done more investigation into this COVID-19 pandemic. You're at the top of the game. I mean, this is just a chart that you handed me today, showing the cases in Alberta. I brought it up on screen for the viewers here. And, your average flu season, your cases per 100,000 in Alberta is between a high of 215 people per 100,000 and a low of 179 people per 100,000. And you've highlighted when Dina Hinshaw called the state of emergency there, and I can't even read what that blue line is at. How many cases were we at when Dina Hinshaw called the state of emergency?
0.4.
0.4.
Zero. That's it, 0.4. Yeah.
And I mean, when you look at something like that, I mean, it basically just in an instant proves that this whole lockdown, all these restrictions, all the guidelines are completely unjustified. Is that what you're saying here?
Yep. Well, one of the things that the government, probably Dina Hinshaw, has to do in order to call a state of emergency, she has to show that we've got an emergency. We've never called a state of emergency in Alberta for any pandemic. In fact, the world has never called a state of emergency for a pandemic. And we certainly don't call one every single year for flu. So at the top of every one of her orders, it explains that she has investigated that Alberta has COVID-19. And as a result of that, she has all these powers to basically take over the province. And she did that with a whopping, huge, colossal, mammoth number of 0.4 cases per 100,000. It's actually 15 cases in total. We went up to a whopping 19 the next day. And our average for COVID, now bear in mind, our average is sort of inflated right now because of that big, huge peak in the middle there of a whopping 71 cases per 100,000, when we had about 3,000 cases, active cases in Alberta, the majority of which throughout this have been symptomatic, as in you didn't have anything. But our average across the board since this started is 21. Our average for flu season, which bear in mind winter is coming, we're entering flu season, is between 179 and 215. They're the last 2 years prior to COVID, and we never called anything. So under what authority she actually called this state of emergency, I have no idea. I've looked at everything the government's produced. I've asked questions. I've spoken to the Alberta health advocate. I've spoken to people in care homes, in senior management. I've spoken to politicians, and I've spoken to doctors, nurses, paramedics, care home workers. And up to now, this chart is about as much evidence as there would be to justify what she did. And that is no justification whatsoever. But without that state of emergency, Dina Hinshaw has no power whatsoever. She's an admin clerk for Alberta Health. The health minister runs Alberta Health, not her. Like literally without this emergency, Dina Hinshaw is nothing more than somebody who fills a chair in an office. So you give that amount of power to someone, guess what happens? Well, we don't have to guess. We've seen it. So yeah, there has never been any justification. And certainly everything that's happened since then has happened as a result of this. Now, bear in mind, what we're using here is the government's own wonderful, trustworthy figures of what a case is. And as everybody knows, as we've been told over and over again, a case is a positive test or somebody who has a symptom of COVID. So a positive test, well, we know how accurate they are. Not at all. The Ontario minister said 50%. There are reports right now from people saying, as low as 10 or 15% is the, or 75, 80, 90%, depending on which way you want to look at it. Basically, not at all. We're at a point where we've peaked. The sort of test per case ratio originally across the world was around about 20%. In Alberta right now, it's 1.8% of tests result in a positive case. That's within the margin of it not even being here at all. And yet we actually have increasing restrictions, as we joked at the beginning about are we in a lockdown? There is no definition before COVID of lockdown for the general population. So we have to use the common term that we've all got used to, the removal of our freedoms and rights through government overreach. I'd say we're in a lockdown. I'd say we never left a lockdown from the point at which Dina Hinshaw said, before the state of emergency, almost a week before the state of emergency, so she didn't even have any powers at that point, she said, we're going to restrict from normal life to no more than 250 people. Well, that shut West Edmonton Mall down that day. Everyone said, we didn't have any impact. There are thousands of businesses in Southwest Edmonton Mall. It was shut that day because it physically couldn't operate, because it was impossible for them to keep less than 250 people in the building. So that was it. Game over for that.
Oh yeah, there's over 1,000 people working in the mall at any given time.
Yep.
And then I like to combine the going back to the testing. I like to combine the words of Dr. Hinshaw and the Chief Medical Officer of Health from Ontario. I can't remember her name, but Hinshaw said the other day that asymptomatic people, and this is the same thing that Dr. Fauci said in the States, is that asymptomatic people have never been the drivers of a pandemic. Those are Fauci's words. Dr. Hinshaw said something very, very similar. And then she was talking about how Alberta had 6 asymptomatic cases per 10,000 tests that day, or however that was. But you combine that with what the Chief Medical Officer of Health in Ontario said, where at least 50% of those positive asymptomatic cases are inaccurate, as in they don't even exist. They're not COVID cases. So this is insane that people are panicking. We've turned our schools into prisons. You can't even sing in church. You can't shake hands with your friends. You can't hug your family. You can't go to a barbecue. I mean, all this cohorting business that nobody's paying any attention to. It's basically just been used as a tool to disown your least liked friends and family. They, all of this for nothing. And let me pull up this chart one more time. So up here, this orange line, this is an average cases per 100,000 line. If you look at the COVID cases here, we have never even gotten close to what an average flu season would be as far as case numbers go. And to do this to our population is absolutely insane. We haven't even gotten halfway to a typical flu season. It's just, there's so many layers of deception in this whole thing. It is absolutely bonkers what they're doing.
And just a quick point. What's the difference between a symptomatic COVID test and an asymptomatic COVID test?
The test or the result? Or no, they're both positive too.
No, so a positive. Yeah, both positive. What's the difference between the two as far as proving that it's COVID? People would think, and it would be spun, well, they've got symptoms of COVID. Has anybody looked at what the symptom list is for COVID? Exactly the same as flu.
Right.
It's exactly the same as almost every coronavirus out there. So OC43, that's the common cold. 30% of of influenza or cold cases come from a coronavirus called OC43. Been around forever, never goes away. We have adenoviruses, exactly the same symptoms. We don't actually do it in the early stages of this. They did X-rays, CT scans, and said, "Oh, we've got these ground glass view on your lungs. That's COVID." It's like, except I've got an X-ray of my lungs from 3 years ago. Looks exactly like late stage COVID. I don't have COVID because it wasn't around in 2017, despite that hiccup on the World Health Organization's website. The reality is there isn't a unique symptom for COVID. So you could have anything and test positive, because test is no more accurate if you're symptomatic than it is if you're not symptomatic. The only thing different is you're sick. If you're asymptomatic, you're not sick. In fact, the criteria for having an asymptomatic test right now in Alberta is you have to have no symptoms whatsoever of COVID. You have to have had no contact whatsoever with anybody who is suspected of potentially having had COVID. And you cannot have traveled out of the province in the last 2 weeks. So literally, you have to prove there is not a possibility you could even get close to having COVID before they'll even test you asymptomatically. And yet, 2 weeks ago, 19,000 people went out on a Saturday and got asymptomatic tested. I don't know what province I moved to. The place I came to 25 years ago actually had some smart people in it. I know, did the air change? Something happened. But who in their right mind says, you know what, I feel perfectly fine. I haven't met any sick people lately. I haven't traveled. There's absolutely no reason. But what else am I going to do on a Saturday? Let's go get tested and have a foot-long Q-tip shoved into the back of my brain, because that sounds like fun. And then if it comes back negative, I won't actually know anything. And if it comes back positive, me and everybody I know, including my business, will be shut down for 2 weeks. I mean, it is literally the definition of insanity. Um, why are we doing it? Why are people out there going along with this? More importantly, why are the people in authority, like my ex-colleagues, allowing it to happen? It just baffles the mind. And when we get onto care homes, what's going on in there? I, I I've kicked doors down and removed people forcibly from their homes for doing less than we're doing to the people in care homes and what we're doing to children in schools. And yet, police officers not only are going along with it, they're actually participating in it. It's disgraceful.
Well, take us back to the beginning with care homes. At the beginning of the pandemic, what was life like for people in care homes? Were you able to visit your mother?
No. Technically, my mother-in-law. She obviously thought something of me because she made me a medical proxy. It's like, I'm not sure that you normally do that to your son-in-law. But yeah, the mother-in-law had a stroke 10 years ago. The hospital at that time said she wouldn't make it. And I fought for her, the family fought for her, and more importantly, she fought for herself. And that's resulted in 10 years she's lived at her care home. And for two reasons. One, she had a severe stroke. We physically couldn't look after her. And it wouldn't be fair to try and do so. And she actually has had more freedom in the care home. She has a wheelchair. She can get around. She can't. She can't get out of it. She could scoot around and visit people. And we would bring her home regularly. I mean, we'd regularly take her out. We'd regularly bring her home for holidays, Christmas, or whenever. And by the time we got to 4 or 5 days, she wanted to go back. That's what she felt of the care home. The care home was her home. She didn't want to, there wasn't oh, can I stay an extra day? It was, no, I've had enough now. I want to go back to my friends, to my space, my own room, my freedom. And then COVID happened, and they literally, every single care home across the province just shut down. There was panic. They didn't know what to do. And we did something that I'd seen happening a bit earlier in other areas. And I said, please don't do that here. We did exactly the same as we did in hospitals. We implemented um, the equivalent of MRSA, MRSA protocols. If anybody's ever been in hospital when somebody's had MRSA, that's the superbug that is resistant to bacteria. And they usually, there'll be one room where that person is, and you've got to go in gowned, and there's nobody can go in there, and it's fully controlled. Well, that's what they turn care homes into. That's what they turn hospitals into. Now, it's simply impossible for any health system to exist at that level for any length of time. And it never happens for more than, a room. At an absolute extreme, you might see a ward, but we saw the whole care home. So, in the example of the mother-in-law Karen's mum's places, 275 residents in there. We've got other care homes like the one on the south side has 411. Sorry, her mum has 275, 411 on the south side. So lots of big care homes, lots of people in them, and then staff who are being told that everybody's going to die if anybody comes in contact with them. So suddenly people who are in care, they're not in there because they're in the best of health and they can look after each other. We've got stroke patients, we've got dementia patients, we've got severely disabled people. There's even young people. There's in this centre. There's one guy's been there for 30 years. It's his home. Suddenly, everybody around them was walking around in gowns and face masks, which for somebody who needs vision issues, either they're hard of hearing, they've had a stroke, they've got dementia, they were put in an alien world, and then all their family was removed from them. So the best you could get, and even then you had to push for it, was you could go and wave to them from the car park through a window. So we spent 2.5 months going up there as much as we could, and we'd sort of pick up her laundry and then drop off her laundry at the door. And then we'd ask them to bring her. She was on the third floor. She'd be wheeled to a window, a smoked glass window, which you could hardly see through. And then she'd look down in the car park with a sort of poor eyesight, looking for us, while Karen and I jumped up and down crying in the car park, waving to her. And that went on for months. And some families were discouraged from doing that because they didn't have the staff to wheel them to a window. It's like, you're not really doing a lot else at this point. But they were. I mean, to be fair to them, a lot of people were thinking, well, what are they doing if there's no one there? What they were doing was running stupid protocols that meant one job would take 10 times longer. And from there, it went downhill.
But just 1 second here. They were put in gowns. They weren't even allowed to wear their own clothes.
No. The staff.
Oh, the staff were in gowns. Oh, okay,
staff,
gotcha.
Yeah. So the staff basically looked like they were about to drag everybody off into an operating theatre every single day, all day. Most of them were wearing gloves. They weren't allowed to be near each other. My mother-in-law used to go all round the centre. She'd just go off to the lift, scoot down, and run round wherever she wanted. And suddenly, and a lot of the residents were confined to their room because they just didn't have any way of dealing with them, and they didn't know what to do with them. And then obviously you had the other residents who are actually bedbound. They can't get to a window. So for them, I mean, the reality is my mother-in-law was one of the lucky ones. She could get to a window. A lot of them couldn't get to a window. And the centres were encouraged through orders from Dina Hinshaw and the zone medical officers who I've spoken to the zone medical officers. They are carrying out orders um, like the Waffen SS. They have no consideration whatsoever for these people. If it was down to them, we would never open these centres again. They would just lock the doors, lock them all in the rooms, and wait for them to all die. And as I say, having been on the phone with one of them, that is, and I've got an email that pretty much says, I mean, it doesn't say I hope they die, but it's as far as they're concerned, other people shouldn't be allowed in the residence into those areas. So we put effectively the whole of our elderly population in solitary confinement. Something we're not even allowed legally to do with prisoners for 24 hours a day for some of them. And then in mid-April, Dina Hinshaw gave everybody a break and created what was called an essential visitor. So your family could pick one person, one designated person, and only one designated person who was allowed to book a visit for a short 15 to 30-minute time once a week where they could go in if you could justify an essential reason to go in. You literally had to beg to actually go in to see them. So I did, as with everything else, I started running through all the orders. And what they were actually doing wasn't quite what was written in the orders. There was a little bit of interpretation. And when challenged on that interpretation, when they were reminded that by effectively doing what they were doing and not being a bit more open, not allowing some of the residents to come out, they were in direct breach of the Provincial Health Act under Dina Hinshaw's orders. And the response over and over again, and it has never stopped, is we're just doing as we're told. AHS tells us what to do. And I said, well, you have a duty of care beyond what they tell you to do. And more importantly, if they tell you to do something that is contrary to what's written in the orders, you aren't allowed to do it. I mean, if they tell you to hold a pillow over the resident's head, are you going to do it just because they told you to? And you know what? There are some people that I think would actually do it. Okay. We have reached that point.
So let's just explain what life was like for these residents. Were they allowed to eat together, or did they eat by themselves?
No, and so they actually there are two phases of life for residents at the moment. There is a regular day when they're not on outbreak, where they're allowed to, on a floor, in one unit, there might be 40, 50 residents in that one unit. They are allowed to pick 6 people, and those 6 people are allowed as a cohort to be able to sit at a table socially distant, so 6 feet away from each other, to eat. And some of them are, depending on what is going on, some of them aren't allowed out of their rooms. But on a good day, anything up to 6 people, and that's been pretty, I mean, although there's been sort of changes to the way the orders have been written, that's been pretty much standard since day one. You could pick one of 6 people in your immediate area, and that was your contact. And the only time you really had any contact was at meal times. However, when we go into outbreak, as they call it, and you'll have heard that term a lot recently with schools, Dina Hinshaw says it a lot. What she explains about...
Oh, David, you've frozen up on us here. I don't know if I've lost you. Oh, looks like we lost David here. Let's see if I can bring him back on. Oh, we're trying to connect because it's ringing. Oh, we haven't lost him. He's out in the country, so I'm not sure about that rural internet stuff. Please bear with us. Minor technical difficulties. While we're waiting there, you can join the protest tomorrow. 1 o'clock at the Alberta Legislature. I think it's going to be our biggest, best one yet. They, I've been receiving lots of good feedback here. People are asking questions, where to go, how to get there, where to park, all that kind of stuff. So I think it's going to be a more popular event this time around, which is awesome. So bring your family. It's a family-friendly event. And 1 o'clock starting at the north side of the legislature. We're actually going to do the speeches and whatnot up on the kind of the higher level patio there. But we just meet in front of the fountains, and we'll make our way up to the top, and we'll have a great little protest. David's going to be one of our speakers. Karen, his wife, is going to speak. She's a former teacher. We've got Chris Schaefer. He is the mask expert. He's an occupational health and safety professional. He's been doing it for over 20 years, I've heard. And he has all the information that you need to know about masks. David, nice to have you back again.
Well, I thought that was my camera went off, but we lost power for a few seconds. My whole system rebooted. So
Well,
I am looking for the lights. Were we talking about a sensitive subject?
Well, we were talking about what a day in the life of a senior person in care homes are, and let's remind people here that these seniors, I mean, these are the very last of our World War II veterans. They, these are people who knew hard times, and to see them just locked away like this with no human contact. I mean, like as David was saying, these people, they don't even really get to eat their meals together. And what happens when they're not at their meals? You say the meals were about the only time they had any semblance of socialization. What did they do the rest of the day?
Sit in their room. One of the things that is now very common is because the staff don't know what to do with them. They don't have the time. The majority of the time for the last 7 months, things like occupational therapy has been shut down. Because right at the beginning, it was, we've got to put these new protocols in place. So one of the things is we have to screen the staff when they come in. We have to point that little ray gun at their head and make them fill out a chart. But they didn't have the staff to do that. So they actually pulled all the occupational therapists and that group of people. They shut down that area because it was, we can't have people. That's like a gym. We can't have that. So they took basically people who've had strokes and everything. Not only did they take their social life away from them, they took their therapy away from them. Massage therapy, that was banned. Jean, for example, used to have massage because of her stroke. To keep her circulation going and get some movement. She'd do PT and OT twice a week. She'd have a massage, would come into the centre once a week. And as a result of that, she's done really well. She could load herself almost on her own in and out of the vehicle. And then suddenly all of that stopped because the PT staff, they closed down the PT area and it was like, okay, well, you can do PT and OT in their room with them. Well, we could, but we're too busy now because we seem to be surplus to requirements from the powers that be. They were designated as people to run around cleaning up, doing all the extra sanitization and checking people in and out of the building. So effectively, we took these residents, we locked them into a small area, we took away their contact with their family, other than the occasional window visit, or they did get really technical for a few occasions where you could have a Zoom call. Having a Zoom call with somebody who is fully able to use the tool and talk is difficult enough. Having a Zoom call with an elderly relative who's had a stroke so can't communicate is physically impossible and actually very distressing for everybody, including them, because they know very well as soon as that screen goes away, it's going to be another week, which for them is a lifetime. So basically during that period of time, everybody was locked in. And there are still some people today who are being actively discouraged from coming in to see their residents. There are people that there's actually um, one care home manager who hasn't even seen her own mum in over 7 months, despite the fact that she knows, because we've explained to her in great detail, just how much she can actually do, and how much she should do, because these people are literally dying in there. There are residents that are say they would rather die. They're asking for euthanasia. There are residents who say they feel like they're in jail, and they're the ones who can talk. And but one of the downsides of when you take that is, well, what do you do with somebody who basically just sits there and vegetates in a wheelchair? Well, it's probably better if you just put them to bed. Now, again, Jean is lucky because she's had a stroke. We had the foresight and were advised to get out one of these inflatable mattresses that constantly readjusts. So it's almost impossible for her to get a bed sore. Not all the residents have them. They're expensive. They're not provided by Alberta Health or by the care home, despite the exorbitant fees that you pay. And so they're in regular beds. Now, what the staff would do is most of them are medicated to help them sleep. So they put them to bed at 6 o'clock at night and get them up for breakfast at 11, 12 o'clock the next day.
You're kidding me.
And I mean, you've seen a couple of pictures, and I mean, if people come out tomorrow, we'll have some that people can see. But there are residents that are developing life-threatening bed sores. Like we're talking about things that would result in amputation, and not because they're at that age or they've got some medical condition, because they've basically spent more than half the day, every single day for 7 months, lying in a bed that it was not designed for. And when they do get up, they get up to sit in a chair. Most of these sores are occurring on their feet. So even when they sit up, it's not helping. Blood pools, and it literally is. We don't treat animals this bad, and yet I hear all the time, "Oh, but we're keeping them safe." But the funny thing is, when you talk to staff in all these care homes, and luckily we've got connections throughout the care homes in the Edmonton region and in the Calgary region, and actually across the world, who've reached out to us mainly through Karen's work, through Facebook and reaching out to people. And we're hearing the same stories over and over again. The residents just want to die, and the staff are losing their mind because it's not what they signed up for. But they've been threatened. They can't do anything. They can't say anything. I've lost my camera again. That time it was the camera.
Oh, we can still hear you. This is totally insane. I mean, not only were visits restricted, but to this day, they're still telling Canadians that you shouldn't visit grandma because it's just too dangerous. Yeah. It's not worth the risk. And so everybody thinks they're doing their elderly relatives a favor by not visiting. And when you're not visiting, you have no idea what kind of care these people are receiving, if their needs are even being met. And I mean, like Trudeau even mentioned this in his speech to the people just this week, that there's a lot of things that seniors can't do. And basically that's just the way it is. And, so when you're by banning visitors or discouraging visitors to these care homes, I mean, this is seriously affecting the physical and mental well-being of these seniors. There's no two ifs, ands, or buts about it. I mean, we've seen pictures of that people have taken of, grandma in December, grandma in January, and then they take a picture of March, and then one of now, and these people are literally just fading away. And I'd say before our very eyes, but nobody's watching. I mean, the staff are hardly even going into these patients' rooms. They're just basically being left to rot. How is this protecting our seniors? Is there any conceivable benefit of Alberta Health Services guidelines for these homes? Like, I mean, the cure is so much worse than the disease. I just can't even believe that this is what we're doing?
So what we've got is, the old joke. Um, the procedure was successful, but the patient died. Um, and and so Jean is, as I said, one of the lucky ones. One, she's got us. Um, every time there's been an opportunity where I've found a loophole, it's not really a loophole. It's what it's there for is the ability for her to leave the property. I tell Karen and anybody I can, get them off the property, take them somewhere, get them out in the sun, get them some fresh air, take them for an appointment, take them like they weren't even allowed to go to the dentist or have their hair cut. For the first 3.5 months, not a single person in a care home had any dental work done or even had a haircut. Now that doesn't sound like a lot, but it's a significant challenge for many people, particularly when you're getting on in age. It's not just to make you feel good or look pretty. It is actually a significant health issue. But even despite being able to get Jean out, I would say more than anybody else has that I know of, and done as much as we can for her. Jean's had multiple falls in the centre, which she's never had in all the years she's been there. As I say, she was there 10 years and she felt like it was a home. Now she's terrified of the place. Karen's found bruising all over her body, and nobody's beaten her. She's just not being watched, and she's fallen. And they've found her hours later lying on the floor. Um, and uh, she's also she can't load herself in and out of a car anymore. And this is just in a few short months. Um, and this is one of the, as I say, she's despite being wheelchair bound and having a stroke and being in her late 70s, she still has always been very active. She's very strong willed and is one of the better ones. I've watched other people in there literally fade away to almost nothing, and it's happening. If anybody thinks that the 30 odd people who died in their late 80s in the care home on the side had anything to do with COVID itself as a disease, that they are not paying attention. What it had to do with is these protocols. Because when we get an outbreak, now, what is an outbreak? Everybody says, well, an outbreak is if one member of staff tests asymptomatic positive, then the centre gets locked down and all visits and all outside visits are stopped completely. We're back into full lockdown mode. That's for one asymptomatic staff member. In fact, it's actually worse than that. We had one extension of a lockdown that was because a staff member's son tested positive, asymptomatic, voluntary. So effectively had no real, there was no known cause. They hadn't been in contact with anyone. And there was no additional cases from them. So effectively they didn't have, I mean, if it's this contagious, and these people are working in care homes, we've had in that one care home, there have been 7 staff members test positive, or rather 6+1 family member. Not a single resident tested positive. Every single one of the residents has been tested pretty much 7+ times in the last 3 months. All, with a test that has no value whatsoever. And every time, some of them get tested twice within 2 days, because one staff member tested positive, and then another staff member got their results back 2 days later. So they went round and did the testing again.
Good
and say, well, why are you doing that? So you have a situation where, so what have we got now? We've got, again, a case which will trigger an outbreak of just one. Just needs somebody to have a symptom or a close family member living with them, like their son. Well, there's a lot of these care home staff that have children in school. So what happens over the next few weeks when half the care home staff find that their sons and daughters have a cold? Well, nobody gets a cold anymore. You only get COVID. There is nothing else. Even if you go, if you have a sniffle and you get tested and it comes back negative, you still have to isolate, even though you've got proof that you couldn't possibly have it, or as proof as you could have because the tests don't work. Um, Still assume you have it. So again, it's like, so if you have a runny nose and you report that, you have to isolate for 10 days. Anybody who is a close contact with you has to isolate for 14 days. So we're about to, I wrote that little article, Winter's Coming. The worst case scenario for these residents and what has actually caused the majority of fatalities and the majority of these.
Uh-oh. There he goes again. Oh, people, you got to take care of those old folks in the homes, man. You got to go visit them. You have to know what's going on. When David comes back here, I'm going to ask him and see, if he's got any tips or tricks as to how to get your favorite old person out of that old home and take him out for a treat or go get him that haircut that they've been missing out on. This is. I'm just going to try and bring David back here right now. See if he's there. Let me hit the button. Connecting, ringing. We'll see if he comes back. Oh, I see a picture. Oh, I see the Skype logo. He's got to turn his camera on, I think. There we go. Okay, David. My question.
The only bonus of this process is I've actually got a fast computer that reboots quick. I'm going to go fire up a generator in a minute. So yeah, as I was saying, we've got a situation where if we continue down the current path of what the current protocols are, which is anybody who has any symptom whatsoever, which for a resident of a care home includes a change in mental health, that mental status. So basically, if you become sad, you are, by definition, you have COVID. I mean, I don't know where they came up with this, but it's not like this is this is in black and white in AHS's own documentation. If you have a change of mental state, now bear in mind, if you suddenly have everybody you know walking around in goggles and masks, goggles was a joke. Staff and anybody going into the centre in a watch area for a home has to wear goggles to protect the care home residents. I'm yet to see somebody cough out their eyeballs. So I'm not really sure what the goggles are for. And the staff don't know what they're for. And when you ask them, you say, why are you wearing the goggles? Well, because it's to protect the residents. And then you try and talk through, well, how does it help the residents? I'm not really sure, but it's what we're told to do. And it's like, with that level of critical thinking, I'm not sure you should be looking after yourself, let alone elderly people. Like if you are literally just following orders that you yourself, as trained RNs, trained LPNs, trained care workers, trained PTs, RTs, OTs, police officers, anybody with half a brain, if you're just following orders to this level, you are no longer a useful member of society. You are a danger to the people around you if that is the level of thought you're putting into things. And as Chris will talk about tomorrow, I mean, this isn't rocket science. It's not like this information is hidden and it's only the gods that are, have spent 40 years hospitals and our top surgeons would possibly understand. This is just common sense. And all the numbers we've talked about today that are quite stark when you put it in a chart, they're on Alberta Health's website. They publish those figures every day. They don't try and hide them. Just like, with the comorbidities and people who are dying with COVID as opposed to of COVID. And to die with COVID, you just have to be suspected of maybe having had it. That's been in black and white since March. That's been the direction for every single death certificate since March. But that is used to create deaths. In Alberta, we've had 8 deaths with no known comorbidity. Now, the primary comorbidity for COVID, for any coronavirus, adenovirus, or influenza, is high blood high blood sugar. So, pre-diabetes or diabetes. Half the population is undiagnosed pre-diabetes nowadays. Even skinny people like me don't laugh. It's a common disorder. It's also the cause of 25% of people who die of influenza every year. Also on that chart, those great big huge high numbers, they're based on decades worth of gold standard verified, lab tested, hospitalized influenza cases, not somebody going to drug because they feel like, why not? I haven't got anything else to do on a Saturday case. So those cases we have at the bottom, which seem ridiculously low compared to the flu ones, if we counted flu the way we count COVID, those numbers would be in the thousands, not in the hundreds. Like we're not treating apples to apples and oranges to oranges. We are taking two extremes in measurements and then using something that has no basis in science or justification whatsoever to destroy. And the first casualties of this were the care homes, and they still are. And I mean, if it is literally the last thing I do, I will stop what they're doing in care homes. Karen and I fight every day. We have, and we do get in fights every day with the care homes. With not with the staff themselves. I've got to say one thing before anybody goes. Care homes have always had a bad rep. They people who go into care homes are not in the best of health. They're not designed as holiday homes where they're going to live out, like they're at some 5-star hotel for the rest of their life. They go there because they can't look after themselves, and a lot of them go there. Like on the South Side one is renowned. It is one step away from a hospice. People die. The 30 that died in that 2-month period. That's every couple of weeks there. Their turnover of residents is quite high. If they wanted to, they could have made that number 60 or 70 or 80 without changing any of the amount of deaths that were in there. But we just put down a number that seems to scare people, and off we go. But care homes are actually they do a good job. The staff there have always done a good job. If they'd have treated my mother-in-law the way she's been treated for the last 9 months, for the first part of their life there, she would never have been there. She would have found somewhere else. It's not the staff. They're desperately wanting to do something. The residents want to actually come outside and protest, but they can't because they're not allowed. They're watched like hawks. It's just sad.
Now, did I hear it correctly that not only was the occupational therapy and the physical therapy stopped, but that they weren't even allowed visits by their own physicians? Is that correct?
Yep. So every care center has, just like you would have yourself, your own doctor. You might have go to a local doctor's office where maybe you've got 2 or 3 doctors, but you have a primary care physician. Well, the care homes have the same. They have 1 or 2 doctors that pretty much, that was my daughter. Sorry, Anna. They have a physician for continuity who comes around and checks them. Now, typically they come around once a week. They're not there every day. They're not resident in there. They'll come around once a week, or if there's a situation where somebody needs to be seen, they're obviously on call as well. But the important part about it is their continuity. Well, one thing that Alberta Health did recently, when I say recently, a few months ago, was they changed in most care homes to putting doctors on rotas, which meant that the doctors that were going in, there was no longer any continuity. So it was hard for them to notice what was changing with the residents' health. Um, and then every time there is an outbreak, they stop the doctors from coming in at all. And it's like, hang on a minute. So you're talking about they're now at the most risk because you're in outbreak and they're being isolated in their rooms, so not really seeing anybody at all who can keep an eye on them. And you're shutting down all healthcare. Um, and like the doctors have tried, have begged to go in and been told no. Family have been told no. Now, one of the things I would advise anybody who's got a resident in a care home, a family member, a friend, whatever, go read. There's two orders Dina Hinshaw put out. 29 2020, which was from June, and 32 2020, which was enacted on the 17th. Um, One of them deals with the day-to-day visits. You are now allowed, two people can go in, designated, outdoor visits. And if you want to take your family member out, you just go and pick them up and take them out. As long as they're not on an outbreak, you go and take them wherever you want. You don't have to give a reason. You don't have to tell them where you go, and you don't have to book it. You can just turn up. It's written there in the orders, and they cannot stop you. They will try and stop you. They have been ordered to try and stop you, but they can't. And this is a lot of what's going on in society right now. I don't think many people realize that most of what is happening by consent.
Right. It's
Um,
voluntary. You
we there isn't. If you look at the orders for Edmonton, as we all know, most of the people watching this will know. Hopefully, some people watching it will not know. If you look at the orders for Edmonton, it's physically impossible for you not to have some exemption. So anybody who's wearing a mask in Edmonton does not know, either doesn't know what they're doing or is doing it because they want to. Um, and that includes the staff in restaurants, bars. In fact, to all you small and large business owners out there, be warned. Um, Chris will talk about this tomorrow. He is the expert on this, but I've also done a lot of work on it. In every single one of Dina Hinshaw's orders where it talks about the wearing of masks, other than in hospitals and care homes, basically medical type facilities, everywhere else, it is a recommendation, even for the staff, to wear a mask, but you must follow health and safety guidelines. Effectively, if you did not wear a mask before COVID in your job, you should not be wearing one now. And employers, if you are forcing your staff to wear them, you are liable for anything that happens. So when they get bacterial pneumonia or pleurisy in the coming months, I hope you've got the insurance to cover yourself
or a
because
brain
that's
injury.
what's going to happen. Or a
I,
brain injury. Yeah,
a
passing
lady I
out. And,
know,
yeah.
a lady I know, Lena, she passed out thanks to wearing a mask, hit her head, and she's dealing with the consequences. And I mean, her speech, it's gotten a lot better, but I mean, for a while, this was sounded like she had a stroke. And I mean, this lady was, peak physical fitness, dancing, and it's amazing how one moment can change your life for possibly forever. I heard about a student in Calgary that blacked out and hit their head, and now they need $40,000 worth of reconstructive dental surgery. So whoever's making people wear these masks, you better be prepared for the lawsuits that are coming your way, because eventually we're going to hear about the deaths. I remember early on in the pandemic, reading reports of people who would crash their automobiles because they had fainted while wearing a mask. And it's like, and there's all sorts of people out there saying that it doesn't reduce your blood oxygen levels. And let's get this straight. A mask is designed to restrict your airflow. If your airflow was not restricted by the mask, it would not be filtering any particles out of the air. So there is zero question about whether or not masks reduce the available airflow into your body. It's not a good idea if you don't need to be wearing it. So knock it off. So, David, just one more time for those folks out there who have not been visiting their loved ones in care homes. Um, just say it again for them. Make it super clear. I know you did it already, but sometimes these people they need a little bit of a little bit of a kick in the pants. Tell them how to go about visiting these parents, and maybe how do they get past the person at the door?
So, every single resident that is in a care facility today has two designated visitors. Um, they used to be called essential visitors because you could only go if you could prove it was essential. Now they're a designated visitor. A designated visitor is one of two people designated by the family who are allowed into the centre anytime they want. Now, HS wants you to book using their track and trace system online to get online. You don't have to use that. You call the center, you say, I'm coming to see my mum, I'm coming to see my dad, I'm coming to see my brother. As long as you've put your name on the list and there's two of you, you can then go in and see them. I mean, bear in mind, don't just turn up at the door if you're actually going to go and see them in their room, because there is a process, and we've got to think about the people themselves who are actually working inside the centres. However, don't not go. Make sure you go. Make sure you go as much as you can. But more importantly, if your resident, your family member, can actually leave the property, if they've left the property in the past, then don't visit them inside. Get them outside, get some sun, get them in a car, drive them somewhere where they can actually experience something of life other than the four walls they have every single day. And for that, you don't have to do anything. As long as you're one of the people who's listed, you can go and pick them up. You can book outdoor and indoor visits if you're not one of those two people. So if you've got family, maybe grandchildren who want to see the grandma or granddad, again, similar to the sort of going in to visit, you don't have to book. You have to say, okay, we want to have a visit. Then you can have up to five people. Up to five people at the same time can go and visit grandma. You have to do all the social distancing and everything, and make sure you understand what the rules are. Don't be doing anything that will give them the opportunity to say, "Oh, you're putting them at risk." You have to wear a mask when you pick them up, and that there are rules you need to follow, and you should make sure they have the best of life and get them out of those centres. The staff will thank you for it because it makes the residents happier. And while they're not in there, the staff have got one less person to worry about. You can also, as of the 17th, new rule, uh, you can actually bring your family member out for more than 24 hours. Prior to the 17th, if they left the property for more than 24 hours, they then went into 2 weeks isolation in their room as
Oh,
had COVID. So you couldn't have them for an overnight stay. Well, actually, you could have them for an overnight stay. You could keep them out for 23 hours and 59 minutes. But 1 minute later, and they get a 2 week isolation in their room where they would be fed in their room. They would be bathed in their room. They would never leave their room for 2 weeks. As of the 17th, now you can actually, um, we've got a few holidays coming up here. Go get your residents, go get your family members, and bring them home for a few days. Um, give them some comfort and some time with the people that they don't have much time left to see. If you don't do it now, then when? Because they might not be there tomorrow, and at some point tomorrow will come. And if you haven't seen them because you've sat at home hiding under the couch for a virus that has a case level the way we've described it today, if you're doing that, then I'm sorry, but you don't think anything of the people that brought you up, the people who gave everything. Some of these people fought in wars for you. The ones that didn't fight fought in wars and are a bit younger, they still went through hell to get you to where you are today, and you owe it to them to give them a life. Not, don't be kidding yourself that by hiding away and, oh, I don't want to make grandma sick or granddad sick. What did you do during flu season? You know, if you are sick, don't go see them. If you are sick of and are actually sick, don't go see them. If you're not sick, go see them. And for all those people out there that say, well, I'm smart, I wear a mask because I'm asymptomatic, which means I might have the virus. Well, you know, when you take your mask off when you sit down to eat, does the virus go away? Because if that's your view of the world, is you might be sick because you're asymptomatic, i.e., you have no symptoms whatsoever of a viral load in your body. If you really believe you're wearing the mask because you might be sick, then you might just have to spend the rest of your life sitting at home alone because you might be sick every day for the rest of your life. And don't give this bullshit of, I only might be sick when I go into the supermarket, or I only might be sick when somebody's watching. If you're wearing a mask, then and you are not sick, then there's something wrong with you. If you are wearing a mask and outside and you are full of flu, then there's something wrong with you. You know, at the end of the day, nobody's asking you to go out there and get other people sick, despite the fact that, unlike flu, COVID and most coronaviruses actually have treatment, which is very effective. Flu doesn't. But don't go. I mean, you didn't go out and go, oh, I'm going to go to grandma who's stuck in a care home and I'm coughing up a lung and my nose is streaming and I can't see properly. I'll go see her and go give her a hug and get her sick. You never would have done that before. So don't do it now. But if you're not sick and you don't feel like you're sick, then go see them. And if
Well,
you
it's a
can't,
common sense. It's common sense.
yeah,
This whole pandemic could have been handled with nothing more than common sense. We didn't need any of these orders. We didn't need any of these restrictions. And we didn't need Dr. Dina Hinshaw live streaming at us or Justin Trudeau live streaming at us from the condo or the whatever is cottage every day. If people had just used their common sense, washed their hands, and stayed home if they were sick, that would have been all we needed to do. There's no evidence that any of this other garbage works. And, you know, they say that social distancing works. No, social distancing, if it does anything, it'll flatten the curve, but it lengthens the curve. You're going to be dealing with the pandemic for a much longer period of time. I looked at the ICU numbers in Alberta the other day. I haven't checked them today. You probably have, David. How many in ICUs in Alberta today?
that I haven't checked today.
Last I looked, it was seven.
It was,
Seven
yep.
people out of over 700 ICU beds. So if we flatten that curve is flat enough, we could let this case level get up to 10 times what it is, and we'd still have a few beds. You know,
Okay, so just on that point, just looking about flattening the curve. I've looked at all these stats since day one from every country in the world, every province, every state, and they all are pretty much identical. They all start mid-March, except for Italy, which started late February, and they all follow the exact same pattern. You could throw one chart after another in front of someone, and as long as you remove the labels, they wouldn't know what you were looking at because they're all identical. The funny thing is, every single one of them starts in March. We have actual proof, despite what Dina Hinshaw sort of cleverly worded in of the people that we tested who had influenza, who had their blood taken in this period of time, we only found one person out of 23,000. Okay, lots of questions around that. But more importantly, we know from the actual testing that this virus was circulating the globe no later than mid-November. There is evidence to suggest that it was circulating the globe as early as August. But we know for a fact it was circulating the globe at a highly accelerated rate, as a respiratory disease does, from the middle of November till the middle of March, 5 months. During that period, where we had lots and lots of undiagnosed cases in Canada, where we had millions of people traveling in and out of the country, most of our travel-related cases came from Iran, not from China, not from the US. It's already circulated all over the place before it came here. We had cases for a long time. But during that first period of time, where there was no social distancing, there were no masks, There were no lockdowns. There was no isolation of care homes. Grandma was saw every day. During that 5 month period in Canada, we had 8 reported deaths from COVID, with COVID. 8. In the following 5 months, since we implemented all of those procedures, social distancing, shut down businesses, masks, everything, because masks didn't come around on the 1st of August when the city brought them in. If anybody remembers, masks were the big thing in March and April and May. They died off a little bit in the summer because it was too warm, and then they came back again. But we've had all of those procedures in place for the following 5 months. And our cases went from 8 to 9,500. So what was it we were doing right? It seems like if all of this is true, and this virus is as virulent as it is, we actually, every single thing Dina Hinshaw did in this province made it worse. Not a single thing she did made it better. So maybe she shouldn't be in charge anymore. And Fauci and Birx and Neil Ferguson and the rest of them. It's time they were isolated for our health.
No kidding.
Because you know what? We have an outbreak of idiocy and psychotic behavior. And that outbreak requires containment. And, you know, RCMP, Edmonton Police, Calgary Police, Blood Tribe, UK Police, US Police, everyone, the sheriff, you have a duty to protect the public. If you have not paid attention to what's going on here at this point and can't see the crimes that are happening in front of your face, then shame on you. You do not have the right to be called an ex-colleague of mine, and you do not have the right to wear that uniform if you are still going along with these orders and you have not done any research. You are better than that. I hope you're better than that. And it's time to stand up and actually ask the questions. Do some research. I'm not pleased to believe anything we've said here today. I'm not asking anybody to believe the chart that was put on there. Go and have a look at yourself. That chart was created from the stats from Alberta Health's own website. Every single piece of information I produce comes from a government website or a government source. I don't put anything out there I can't back up. There's an awful lot of rumors and conspiracy theories that fit exactly what's going on right now. I don't bother talking about them because you don't need to. I mean, there is no need to talk about agenda this and agenda that and, oh, is it these people or that people? You don't need any of that. The facts alone should be enough to put a stop to this.
Amen. Amen. Yeah, I mean, when I woke up, I think it was March 3rd, I made my first public Facebook post saying that I thought this was bogus, but at March 3rd, there was very little information out there that was contrary to what the media was pushing. But the way my wife and I came to those conclusions was just by running the numbers that were in the news every day. When you look at Italy and you saw so many people died in Italy, you divide that by the population and you realize that it's about, this much of a 0.00 something of a percent. And then you look at the numbers for South Korea, and then the headlines came out and said that 99% of the Italians that died didn't have COVID listed on the birth certificate. They died of other things. They just died with COVID, not of it. When these things start trickling out, those are your cues to pay attention and get your brain cells firing here. I mean, this is fourth grade mathematics here. I mean, if Canadians would use just some simple fourth grade mathematics skills that we all should have, we would be in so much better shape right now and we wouldn't be drinking this Kool-Aid. Which brings up my next point. I'm just going to bring up the protest poster for the people one more time, David. I made a pitch for it already, but would you tell the people why they should come to the legislature grounds tomorrow at 1 p.m.?
In short, your life depends on it. You need to come out to truth. You need to come out to meet people who can tell the truth. We will have people there who are experts, who will tell you about masks and mask wearing, not from the basis of somebody who's worn a mask, but somebody who actually has spent 20 years training people on how to use masks and why they're used, respirators, breathing apparatus, everything. You'll be able to ask people questions. I'll be there. I've been researching this since December, and I have researched this to death. You might catch me off guard with one or two questions that I'll have to get back to you in a minute or two after, but I can give you most answers to most questions you're going to ask me about this, and I'll tell you a lot of things that most people won't know. Josh has been following this and is connected to everyone. He will talk to anybody. He will answer questions. His speeches will lift you up, will make you feel better. We have some people coming there who are um, directly connected with the care homes. We're going to have some children who are in school there who you can ask, what's school like? We have potentially one person who's coming from a school who's got some horror stories to tell, not just about the way the school is working, but how they've switched out the regular policing staff that used to work in the school, and have put people in there that are more interested in handing tickets out and refusing children to leave the property during their breaks, which the last time I checked is an unlawful detention. But that's what they're doing. So anyway, you're going to speak to a lot of people that are interesting, but more importantly, hopefully you will have your eyes opened. You will connect with people who we use the term wake. It's time to wake up, everybody. If you're unsure, you know what? If you're scared and you're not sure what's going to happen, nobody is going. If you turn up in a mask, nobody's going to berate you for wearing a mask. Um, if you want to come and talk and you feel nervous about getting too close to someone, we will respect that. We will talk to you. Hopefully, by the end of that conversation, you will feel comfortable enough to take the mask off and get a bit closer. But if you're not, don't worry. Nobody, people are traumatized by what happened. Um, Part of my life is understanding how, through my cybersecurity work, is how the media and social media works and how it is able to manipulate people. Um, Take it from me, I've given lectures on this internationally for a number of years. The people who are truly, genuinely scared right now and are wearing masks because they believe that it is the only thing they can do, it is something that you have been programmed. You have been psychologically damaged, and you need help. That doesn't mean to say you need to go book yourself in to see a psychiatrist. You need to talk to people who can help you understand rather than scream at you for not wearing your mask. You will not at this, unlike a lot of other rallies out there by people who are, on trying to help people. The one thing you'll find out about the rallies for people who are standing up for people's rights in this area, in this arena, you'll find that every single one of them is a nice person who's just trying to help. Every now and again, we get a little bit shouty because we get really upset. We're not shouting at you. We're shouting at the people that did this. We will raise our voices, but we will talk quietly to you. We will help you. We will pass our information on to you to help you get through this. And understand that there isn't a single person that's going to stand up there this weekend that gets paid for this, that gets any. We're doing this because, and we're not. I mean, for me in particular, it would have been a lot easier. I live on an acreage. Um, Me and my wife could have just gone, you know what, screw it. I get a pension from the police. I just don't want to do it. I can just let the world go past me. Just sit there and watch my five border collies. But it is bigger than me. It is bigger than you. This is about all of us. And you don't have to be out there being an activist. But for God's sake, just come out and actually say something. And I will say one last thing. For those people in Alberta, and I still can't believe Alberta and Texas are two of the quietest places on the planet right now for actually speaking out. I don't know why, but they are. You wouldn't believe it if anybody had said in the world that the two places in the world that would lie down first would be Texas and Alberta. You would have left them out of the room, but we have. Now I heard a lot of people saying, "Oh, but what they're doing is They're the silent ones. They're waiting till it gets really bad. Well, guess what? It got really bad in March. How bad are you waiting for it to get? Are you waiting for it to be a civil war and blood to be spilled in the streets? Because if that's what you're waiting for, you are no better than the people that did this in the first place. The time for waiting and being quiet and silent in the background and saying, I'm going to be prepared. I'm a tough guy and I'm going to do something. Well, you know what? You know what the toughest thing to do is right now? It's what Josh has been doing for months. It's what the other people that go in there every single Saturday have been doing for months. Cody, Kyle, Anthony, every one of you. I've been doing it for a couple of weeks. I've been doing all the number crunching and connecting to people like Dolores Cahill, Dennis Rancourt, Yoram Lass from Israel. But I don't feel like I've been doing anything. The people who've been on the front line, as far as I'm concerned, is Josh, is the people like him who've got up and spoken about it. They're not running around smashing windows. They're not running around burning buildings down. They're not running around saying we're better than you. They're out there fighting for every single person who doesn't really like them. You know what it's like to actually go out every single day and be hated by the people you are fighting for. And guess what? Despite all of that, he still goes out. He's sitting here today. He's given up his evening. I'm sure he'd rather be sitting with his wife and watching a movie and, you know, having spent a bit more time with his kids. But he's not. He's here and he's not doing it for him. I mean, yeah, you know what? We're all doing it for us because we know where this is going. If nobody stands up, then guess what? Just imagine winter is coming. Look at those flu numbers on those charts. And when I said to you, if we actually counted, if we counted COVID like we count flu, sorry, if we count flu like we count COVID, those numbers would be not 215, there would be 20,015. We have millions of cases of colds and flu in this province over the next 6 months, every single year. Now, because we treat everything as if it's COVID, if you've got a sniffle, if you've got a cough, if you've got a sore throat, if you feel a bit sad, you've got COVID. You will be isolated for 2 weeks. Imagine in a couple of weeks' time when Dina Hinshaw says every single death we've had in the province and every single person who's had a sniffle is a case and a death. What are you going to do when she announces in a couple of weeks' time or months' time there's been 50,000 cases over the weekend and 500 people died? Not a single one of them will have died of COVID. But what will you do when she says that? The province will be shut down. If you think you can wait till the next election in 2023, if you think that we're going to get through this flu season and just go, well, it'll just be like another flu season, but we'll be wearing masks. Think again. The protocols today say if you've got a cough, if you've got a sneeze, if you've got a tickly throat, you have COVID. There is no test to prove otherwise, and they're not doing anything. And the treatment for COVID in this province is go home and stay home until you either get better or die. You know what? I don't think we did that in the 1700s. Do you know another thing? If you really think you are sick and walking around, do us all a favor and give us a laugh. Instead of wearing a mask, carry a bell and shout unclean, because at least we'll have a laugh at you. At least bring some fun into this insanity. Because wouldn't take that many people walking around Costco with bells shouting unclean before everybody goes, you know what? Let's just give this up. This is a joke. But that's what you're doing with your masks. You are walking around shouting unclean. And for the people who are awake and look at them, you may as well be ringing that bell, because that's how distressing it is to see somebody who's putting them through this because they just won't spend the time to ask some questions and read it up. So this weekend, come out and talk to someone. Talk to somebody other than the TV. Talk to somebody other than Facebook, despite the fact that we are ironically on Facebook. But come out and talk to a real person. It's amazing what happens when you talk to somebody face to face. And there won't be anybody on who's there to talk who'll be wearing a mask. It is not a requirement to wear a mask outdoor anywhere in this province. In fact, anywhere in the country. You do not have to wear a mask outside. Outside is where the air is and the fresh air and wind. And yeah, sorry,
That's
getting a
awesome.
bit ranty then.
No, that's okay. And you know what, folks? We
It's
really.
not COVID.
Oh my goodness! I might have caught it through the screen. Should have had my mask on. The we've done everything we can to make these protests family friendly. My 7-year-old boy, my oldest, he has been out to pretty much every one of these protests that I've attended. My wife brings out our other 3 kids when the nap schedule works out, and there's other kids there. They play, they have a good time. So don't worry about having to find a sitter or leave your kids with somebody else. Just bring the whole family down. I don't know if we're going to be having a march again tomorrow, but we'll do the speeches first. And those that want to march can march if they want to march. And it's actually a really, really fun time. And thank you, David, for those kind words that you said. To anybody that doesn't know, my real name is Josh. So when he refers to Josh, that's me. I'm not just the angry Albertan, as much as I like to pretend on the internet. So, and you can find both of us on the internet. David Dickson actually shares a Facebook account with his lovely wife, so you can find him and follow him at David Aaron Dickson on Facebook. He's also on Telegram with me. We're trying to circumvent the Facebook Gestapo and stay out of Facebook prison. So you can find either myself or David Dickson on Telegram if you have something to say about care homes, or if you're concerned about a relative of yours that's in a care home, or if you just like to contribute a story that maybe will help us end this thing, because we need to wake people up. And you know what? If you're on our side and you aren't working on your friends and family, trying to get them to see the truth, I know it seems like an impossible task, but we really have to wake up our friends and neighbors. If we can't wake up the people around us, then we're dead in the water. I mean, this is all for nothing. And it's really sad to see this level of brainwashing and mind control grip, so many Canadian people, ripping apart families. It's just an incredibly sad situation. So please come out and support us and support humanity by coming to the legislature tomorrow, 1:00. We're going to be on the north side of the building. We usually do a little meet up there, and then we'll just walk up the hill just a little tiny bit so we can get a really nice camera angle for the speeches, so we can broadcast those on the internet. You can tune into those speeches here on the Angry Albertans page. And thank you all so much for tuning in. Thank you so much, David, for putting the effort it took to get you on here. I know you set up the fancy camera. You look fantastic, and it was a real pleasure to have this interview with you. Thank you, David.
Well, thanks for having us. It was a pleasure, as always. And from me and from every Albertan, awake or asleep, thank you for everything you've done since you started this. We needed an angry Albertan. We got an angry Albertan. But the reality is, you're just a big softy at heart. But you are exactly what we need. And you always have been, and you always will be. We are Albertan. I'm a pretend Albertan, but I am Canadian. Moved here a long time ago. I feel Albertan. I just would like to see some more Albertans out there. You don't have to be angry. You just have to be Albertan. There was a time when that meant something. It is time to bring that back. Come out of the silence, come out of the shadows, and come talk before it's too late. Now is the time. Not tomorrow. Well, actually, tomorrow is the time, but not in a month's time. Not in 6 months' time. Not when things get really, really scary. Guess what? If you were somebody who was locked up in a care home 7 months ago, things got really scary 7 months ago. And one day, if we get through this, you might be lucky enough to end up in a care home with people looking after you. And I'm telling you right now, you will never thank yourself for having sat back and waited for it to get scary. It is already scary. Now's the time. Stand up, do something. And every single police officer out there, particularly, I'm going to name one person right now, just as we've got the last few minutes to end up on. Glenn Motts, you were the deputy chief. You were an inspector in Medicine Hat Police Service. I sent you all my research right at the beginning of this, and I've sent you all the information of what's going on in the care homes. You are a police officer. You are now an MP, and you are the MP for Medicine Hat. I don't know whether your staff have been hiding this information from you. Feels like it's virtually impossible for you not to know what's going on. So, Glenn Motts, as an MP and as a retired police officer, you have a duty. Now, a slightly less than family friendly person, get off your arse and do something. Don't make me come down there. Thanks.
Yeah, I imagine David would be pretty mean with a cane. I'd like to see you wear the monocle and beat somebody with a cane at the same time.
Multitasking at its best.
Well, are we going? Will the monocle be making an appearance tomorrow?
The monocle will be making an appearance.
Oh wow, we're in for a treat.
I've got to go and bull my shoes after this because somebody stepped on them last week. So.
Oh, it all started with Anthony and I wearing dress shirts, and then David has to show up, and I don't know how many pieces that suit has, but it's worth coming out just to see that suit and to see somebody wear a monocle in the 21st century. You may completely disagree with us, but...
And if you're really lucky, I'll show you my pocket watch.
My son was thrilled about the pocket watch and the monocle. But all right.
And they are real. They're not props. They are real.
Anyway, David, thank you so much again. You are an absolute fountain of information. Some of the best research I've encountered. Like every time I speak to you, my mind just gets blown because, I mean, I've spent a lot of time reading about this, but the research that you've done and put together and your investigative background. Follow him, David Karen Dickson, on Facebook. His posts are incredible. He writes articles. I believe you can find him on LinkedIn, too. He's got a bunch of articles on there. Worth following. If you can't remember that, go to the Angry Albertan page on Facebook, and, you know, especially in the group, he's always posting in the group, and you can follow him from there. So remember, there's an Angry Albertan page and an Angry Albertan group. The Angry Albertan group is for you to post your ideas and the things that you find in the news and the information that you're finding. And then you can share it amongst the community. So we all have a say here. I happen to be the guy on the front page, but I'm trying to just do my best to represent as many Albertans as I can. So thank you all for being here. Thanks again, David. We'll end it there. Thank you all for tuning in. Bye.
Bye.